Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
uh, being being functional as it relates to responding to the community and its needs. And they talk about changing the entire way it's operational. Of course, it'll take time. I always uh, wonder when they change one person. If you only change one person and don't change the structure, you don't really change much. But anyway, it looks like they're going to have an overall change of the CDC to try to make it more responsive to the community's concerns. The most recent episodes revolved around the responsiveness to monkeypox and the concern that although 98% of the people involved are men who have sex with men, there's still a population that needs to be served. And also, it starts with men who have sex with men, but then it goes from men who have sex with men who have sex with women as well. And so it's a cycle that needs to be cut off at the head. So that was one of the articles. The second article is a great article on prescribing foods for a healthier life. And it talks about the fact that something we've talked about for quite a while. We've long talked about exercise, but we long talked about uh, one of the best ways to live long is to eat right. And it talks greatly about the benefit from dealing with, I'll read what it says: eat right, plenty of fiber, lean protein, healthy fats, whole grains, beans, vegetables, and fruits, and nuts, and seeds. And you reduce your risk for heart disease, diabetes, colon cancer, dementia, and many other conditions. The emphasis on plant 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 foods is uh, not surprising, as Darryl has talked about this ad nauseum, almost. Uh, and it talks about not only the nutritional elements that are good for general, but it talks about specific illnesses. Those who have gout, it talks about the role of tart cherry juice and how that can help, and that the one group of tart cherry juice daily for 4 weeks will reduce the uric acid level. And it talks specifically about avoiding alcohol, fatty meat, and sugary drinks because they aggravate gout. Anybody who has had gout recognizes it's one of the most painful conditions you could ever have. Then it talks specifically about constipation. It talks about remedies being raspberries, artichokes, and chia seeds. And that one thing to do as you uh, uh, eat those is remember that dried fruits such as prunes and apricots can be helpful. But to emphasize, always drink a lot of water with the fiber. Otherwise, things could get worse. And avoiding fatty meat again, dairy products, as Darryl has emphasized, and the refined carbohydrates. And then for insomnia, those people who can't sleep well, they talk about oatmeal and kiwi fruit as being uh, products that help overcome the people who can't sleep well. They also recommend avoid drinking or eating foods with caffeine close to bedtime, and also alcohol uh, as well. And for those who are old and men who are old and who uh, have frequent urination, they recommend pumpkin seeds, which we've talked about before for other reasons, and indicate that research is identified as a source of helping reduce the size of the prostate, which causes the frequent urination. and avoiding diets high in fat and red meat increase the risk. And then finally, depression talks about the foods to help with depression would be salmon, tuna, trout, and sardines because they contain products that uh, affect the brain and produce the omega-3 uh, products that uh, to help avoid decrease the impact of depression. And they talk about avoiding processed refined foods. And uh, so these are just some of the little tidbits and hints that are in this article that talks about prescribing foods for a healthier life. We've talked about it quite a while anyway, but just to reemphasize the focus on the nutritional aspects as well as the exercise, which we talked about at nauseam. Any comments? It's nothing new in any of those articles, but it's reinforcement of what we've talked about.
Dr. Callen, I have a question. Um, I may have missed it when you talk about the first article that you found in the Washington Post about the monkeypox. I heard on the news that, and you may have said this, that they're trying to, right now, they're trying to not characterize it as a sexually transmitted disease.
Well, it is.
Yeah. So,
It is.
Yeah, it is, but they're trying to not classify it as that.
But it is. You can't not classify it when it is.
And so I think that's the Rainbow Coalition that's
Probably,
trying.
but I think that's not accurate. It is it's transmitted by many means, but the commonest way is sex, and it's of course you can also be unclean, and touch people who have the lesions because it's not only transmitted by sex; it's transmitted by touching people who have the sores.
Yeah, I was just wondering if you had seen that.
Yeah, but that doesn't make sense. Right. Right. You can't make a lie the truth. And I think it's important to recognize that there are many ways of transmitting the disease. Sexually is one of them, but there are many ways of transmitting. But that doesn't make it not a sexually transmitted disease. It is a sexually transmitted disease.
I have a question, Doc. So with all these suggestions for diet and exercise and everything, and if we are conscientious about our health, which everybody here is, of course.
Who's that guy behind Darryl?
How often should we get blood work done or see our doctor? You know, if nothing's going on, if nothing is a problem, we tend not to see the doctor. But some of the ailments that we can get are hidden, and they don't have symptoms. How often would you recommend seeing your primary physician? So
Well,
I only see mine once a year on purpose to get a physical.
well, there are different reasons. For example, as we've heard talked about, the colonoscopy is important to get once you get over the age of 40. Okay. For the most part, getting your eyes checked every 2 years is essential. Getting your ears checked every 2 years is probably essential. And then short of that, it's not a bad idea to check your blood pressure weekly or so to see what your blood pressure is. But seeing the doctor more than once a year, except for the routine, for example, mammograms under the age of people who are under the age of 65 annually every other year is probably okay. And so there's screening things that you need to get anyway, but an annual checkup is reasonable. But
Okay.
there are other things that you ought to do regardless of that, because getting a mammogram, getting a colonoscopy, uh, uh, among other things, and getting your eyes checked and ears checked are things that you just ought to do, and independent of seeing your doctor once a year.
Thank you.
Okay, if there are no other questions, I guess we can go to the number of articles that we have
I have a
here
question.
for you.
How would this affect a person that has a transplant? You know how you have to be careful with a transplant. What is the survival rate? What kind of effect would it have?
Well, your question is unclear. Uh,
You
the
know
advice
how?
we gave, the advice we gave is for everybody, whether you're a transplant patient or not.
No, but
Uh,
I guess because I'm talking about, say for instance, if a transplant patient gets monkeypox or whatever, right? How does
If,
that
if
affect them?
if a transplant patient gets monkeypox,
Mhm.
oh, well, it's a infection, and transplant patients are more susceptible to infection than anybody else. And so it would be important as a transplant patient to be sure that if you interact with people, that you wash your hands after interactions, and wear gloves if necessary around people who have sores. That would be my advice. But the transplant patients are immunosuppressed. As a consequence, they're more likely to be infected than anybody else. So they have to be more careful. And wearing gloves is a good protection, as well as we talk about cleanliness being important.
Okay, thank you.
Okay. This is an interesting article because this is going to be of invaluable help to those people who don't want to go to the audiologist and to admit to the fact that they have a hearing problem. And this then makes it easy for them to go to the pharmacy and just get it over the counter. This, of course, the question is what kind of hearing aids are they going to make available? Because hearing aids range in cost from hundreds of dollars to thousands of dollars. But I think since the majority of people over 70 have hearing problems and don't do anything about it, this would be very helpful. We also know that there's an association of hearing disabled people and Alzheimer's and dementia. And so this will be very helpful. As you see, the current price averaging more than $5,000 typically are not covered by Medicare. And so this would make a big difference. So I think that this is something that is very good for the average man and woman. And so I think this is a nice step, especially since many of the deaf people or hearing disabled people don't listen to their loved ones when they tell them that they need to get a hearing aid.
You can't hear them.
Yeah.
So they're going to have extra security at the CVS.
Well, that's what you would hope, but we shall see. I hope that's the case because you'd like to have a lot of people taking advantage of it. But we shall see.
You know, my audiologist made the point when I was asking how come, they cost so much. She said that they are tuned specifically. I think Darryl knows about this too. They're tuned specifically to your hearing profile. When you get your hearing test and you see which frequencies are deficient in your hearing, the ones that cost $3,000 and $4,000 and $5,000 are tuned to you. If you go into a the giant pharmacy, and those things are I can't see how they're going to be able to specify the frequency response and settings on those hearing aids.
That's a good point, and that's something that was one of the reasons why it was not over the counter before. But because there's so many people who don't take advantage of it because of the price, they have done this to try to make it available to the guy who can't afford a $5,000 hearing aid.
Dr. Callender, isn't that the same thing as glasses? People go to CVS to get reading glasses rather than going to get their eyes checked and get the right prescription because of the cost and convenience.
I don't know why people do that, because the cost of the cost of glasses in the drugstore is what, about $20
or less.
Yeah, and you go to the doctor, it's going to be about $200 or $300. So it may be similar, it may be similar. Maybe you still people go to see their eye doctor and get prescription glasses, but the availability of the glasses over the counter allows more people to just go and pick up whatever magnification they think works best for them. So I think it's a good analogy.
Here's something that most people don't realize is that hearing tests are generally free. So any hearing aid place, you can make an appointment and go get your ears tested for free, because they're trying to sell you the hearing aid. And so there's no charge for the actual hearing exam. When you don't hear, you don't have good conversations. And when you don't have good conversation, your brain kind of fogs up, like cobwebs set in. And that's the start of dementia, just because you can't hear people, so you don't talk, and your brain just fogs over. So they recommend people over 50 every year they get an annual hearing exam. What I found out, I've been wearing hearing aids for a couple of months now, and there's all different levels of hearing aids. Some are bad, some are excellent. The more you pay, generally the better hearing aid, the better hearing experience, the more natural it's going to sound. But even the bad ones are better than not being able to hear. So the prices can range from online hearing aids that you buy a pair for $300. They're the really terrible ones. You can go to Costco, and their bottom of the line is about $1,300. Or like it says, you can get the $5,000 pair of hearing aids. I got top of the line. I tried the variety of hearing aids, and you have to pay really decent money to have a natural hearing experience. As a musician and recording engineer, it's important for me to hear naturally. So, I kind of bit the bullet and paid big bucks. But if you're with somebody that's got a hearing deficit, don't let up. Just keep your foot on the gas pedal until you get them to an audiologist, a hearing instrument specialist to do something about their bad hearing, because their brain is going to fog over, and they're just a pain in the butt to you and everybody around them.
Well, I think this last paragraph says it all. Among those over 70 with hearing loss, only 1 in 3 have ever worn hearing aids. So you can see that the need is great, as John Tatum suggested, or Buchanan, that the need is great. Now, will the people who need it the most do what they need to do? Time will tell. Let's hope that this does cause a commotion at the pharmaceutical places. This is an article on, this is National Minority Donor Awareness Month. And as a consequence of the shortage of organs, 17 people die every day because of the shortage of donors. And so since we have over 100,000 people who wait, and we only have 40,000 transplants a year. You can see so many people are waiting, and so the need for ways of getting more organs is really desperate. And so one of the ways of addressing this is by having xenotransplantation and stem cells and other ways of and 3D printing is a way that eventually will come to be one of the sources of organs. When that will be, maybe in the next 5 to 10 years, but it certainly is something that is becoming closer and closer with time. They're printing bladders, they're printing ears, and next eventually they'll be printing organs. When will they be available? Who knows? I would imagine within 10 years.
What material are they using? Are these plastic organs?
No. The organs, they should be vascularized tissue. They should be actually tissue that is used to make the organs, so that they have to be done from vascularized tissue. And that's the problem. At Wake Forest, they've been doing this since 2005, but doing it for tissues and other tissues, bladders of tissue. And so we don't think as much of it as an organ, but that has been done for quite some time. But doing it for organs like the kidney, the liver, lungs, that's going to take a while longer.
What's the source of the tissue?
We would be the source of the tissue. In other words, whether it comes from whether the organ comes from it would be another human being. Yeah.
Sounds like science fiction, though, doesn't it?
Yeah, but it's something that is in the works, and there are many places that are doing research on it, so that we think that it's likely within the next 5 to 10 years it will become a reality.
Dr. Callender,
What'd you say?
the tissue is one of the many things that can be recovered from deceased donors. Is that correct?
I didn't hear the first part of what you said.
Tissue is one of the things
Oh,
that
yes.
can be used as transplant, tissue,
Yes.
eye tissue, and so forth.
Yeah, tissue's easier than organs, right?
What is vascularized tissue?
That tissue that has blood going through it.
Okay, thank you.
That's what it means by vascularized tissue. So, for example, the bladder is not as vascularized as many of the other organs. So it's a lot easier to do that than to do a kidney or lung or liver or heart, because they're truly vascularized. There's a lot of circulation through it, and that's the area that is difficult to replace so far.
So rather than asking to donate an organ, they'll be asking to donate tissue?
No, we'll be doing both.
Okay.
We're doing both. The tissue is one thing, the organ is another. Right now, we ask for organs and tissues. And tissues made a difference in terms of how rapidly many athletes recover from surgery, because they have donated tissues from people who've died and left tissues behind. But the difference between those and the organ which has blood supply going through it, like the kidneys, the lungs, and the heart, is that the circulation of those organs is critical, whereas for tissues, you don't need blood going through them. So this is where the future lies. Any other questions about that? Because I think it's especially since this is National Minority Donor Awareness Month, it's good to address some of these issues relative to transplantation and the donor shortage. Okay, this article is a article that I thought was interesting because when it looks at the key heart repair gene, it turns out that steroids, which is important for preventing rejection, is partially responsible for the heart not being able to recover from a heart attack. And they are saying that when they use medication that prevented the effect of the glucocorticoids, then the heart was better able to recover from the lack of circulation. And so what they were able to determine is that generally, whenever you get sick or anything happens bad, steroids help you. But in this situation, the steroids actually prevent the heart from recovering. And this is a brand new finding that may help people who've had a heart attack recover more quickly from the loss of circulation to the area. Because what happens now is when you have a heart attack, the area that loses blood circulation dies and you have fibrosis. And that means connective tissue there, but not muscle. And this then means that your heart doesn't pump the blood adequately. And eventually the low circulation leads to congestive heart failure and also to death of the heart and death of the person. So this is a little complex, but I'm just trying to oversimplify it by indicating that what they're finding is that the gene receptor for recovery is blocked by steroids. And this gene receptor, if the steroids are blocked, may lead to heart muscle recovery. And that's, of course, the issue.
So, Dr. Callender, does that mean that they would still give the steroid, but given the blocker, you'll still be able to avoid the negative effect on the heart?
No, they would not give the steroid. They give a steroid blocker. Because, in other words, they wouldn't give steroids. In other words, naturally, you have steroids produced. And it's the steroids that are produced because of trauma and shock that go to the area and block the heart from regenerating. And so then you would just give this steroid blocker to the heart, and that would allow the heart to regenerate, which it can't do because of the presence of the steroid.
Oh, I didn't know that the body makes steroids.
Oh, yes.
Naturally.
Oh, yeah. Yes. Yeah. The flight and phenomenon whenever you're stressed, your body, your adrenal gland creates steroids because whenever you have any stress, steroids are produced. So this then would be a way of negating the natural impact of steroid that is ever present. Yeah, the adrenal gland is the source of the steroids, the natural source of steroids.
Very interesting.
Okay. Now this is a subject that is becoming more and more important, frailty. And I guess it's important to understand what frailty means. And frailty means that there are 5 categories that make you frail. One is that you have unintentional weight loss. Second is that you walk very slow, if you can walk at all. Third is that you do not exercise, and these then result in you being considered frail. And the reason the category becomes important is because people who are frail die more often with any procedure, but they die even more often with low-risk procedures and high-risk procedures. So if you exercise and you haven't lost weight and you can walk reasonably quickly, then these point to the fact that you could have low-risk surgery without much expectation of morbidity or mortality. Whereas if you're frail, then it's unlikely that you would survive any kind of operation, whether it's a minor procedure or a major procedure. And so it goes back to what we talked about initially. Eating the right foods, exercising, all of those things keep you from being frail. And fragility is probably associated more with aging than with anything else. And so, which is why it's so important after the age of 40 to be involved with exercise and proper nutrition, because frailty results in falls cause fractures and other things like that. So I thought it would be a good idea to just include this so we'd have an idea about frailty. And so you'd have an understanding of if you're going to have surgery, what are the things that would be associated with a better income. And eating properly, exercising, walking around, and other things are associated with better outcomes for any kind of surgery that you're going to undergo.
So do you have to have all of those things to be considered frail, or just one or two, or?
Well, generally, the more you have, the more you are likely to be considered frail. The less you have, then the less likely you're to consider. If you have all of them, then you are frail, fragile, and it is advised that you become not fragile if you're going to need to have surgery.
I guess I asked that because my thoughts about someone being frail is some small person that, but you don't have to really be small to have those different.
That's correct.
Mhm.
You could be obese and
Yeah.
be fragile and frail.
That-
Yeah, but we traditionally tend to think of that as somebody. Of course, that person who you speak of is likely fragile as well and frail. But you can be obese and be frail as well.
Okay, yeah. That's what I had concluded. That's why I was asking the question.
Mhm.
Sitting here talking to him.
Now, this article may bother Carol more than anybody else because she doesn't like terms, aged and aging, and now they got a new term, super elderly. It's bad, not bad enough to be called old or elderly. Now super elderly, and they call people who 85 or older super elderly, and they say this is a group of people who have to be very careful about anything that happens to them, and they talk about the fact that surgery or anything that is done is likely to be associated with increased complications, unless, of course, they are free of comorbid issues. And what they're saying, as you get beyond that age, you're more likely to have cardiac issues. And of course, we all know that there are many kinds of conditions that cause heart failure, including arteriosclerosis. And then, of course, the one that is more likely to cause death than anything else is arrhythmias, which occur the older you are, the more likely to have that. And then aortic stenosis is another disease that occurs more often as you age. And then, of course, the thing that is associated with more deaths than anything else in the elderly population is falls and hip fractures. And so that this is something that is feared. Most of the elderly or super elderly patients that I know of that die, that don't die from cancer, die from complications of falls.
Dr. Callender, excuse me, can you just go back one? Stenosis, what does that mean?
Oh, that means the aorta is the largest blood vessel in the body. And when you get arteriosclerosis of the aorta, it narrows. And when the aorta, the big blood vessel, narrows, then you get hypertension and many other complications, and also poor circulation to the heart. And this then is something that if you have it, actually requires surgical intervention.
Yeah, Dr. Callender, are there any guidelines under which an elderly, fragile person should undergo surgery?
Yeah, when they are not fragile. In other words, if they can walk on their own, if they can, if they're not losing weight, if they are exercising, this then, so that the way to avoid being fragile is to be active, and also to eat appropriately and be active. That's the way you address the issue of fragility.
Dr. Callender, what is elderly? What's the age for elderly?
Elderly is probably from 75 to 85.
Okay, so I'm not elderly yet.
Yeah, you're probably senior.
I'm just a senior. Okay.
Probably. And the super elderly is 85 and above.
And so this article is just saying they've analyzed why people die, because people do die. So
Well,
these are the different various factors of why we die. There's nothing really you can do to prevent from dying.
yeah. We started off by talking about that. Eat proper and exercise.
But even after you eat proper and exercise, you're still gonna die.
Oh, well, yes, you are. But I mean, okay. Well, we all are dying. So that so far, nothing has prevented mortality. So immortality is not part of our gene product. So everyone who is born will die, except for the exceptions that we know of in the Bible. But yes, so yes, answer your question. Yes, all we're doing is delaying a death, not preventing it. We have no way of preventing death right now.
So if you're fragile and you need surgery, they won't give you the surgery because you're fragile, but then you need the surgery, but you can't have it. So
well,
you
no,
can't prevent your inevitable death.
Well, no, what you do then is get away from the category of fragility. So you have to exercise, proper nutrition, and no longer be fragile. So it's the prevention of fragility, which is the issue. But as you point out, we're all dying. It's just a matter of what you die from. But anyway, still, the goal for many is to try to live as long as possible, as qualitatively as possible.
Dr. Callender, one more question. Is there a law that have to say that everybody has to be analyzed to see why they died, You know, it used to be somebody just passed and you didn't analyze what did they pass from. But so now the first question after you hear someone pass, why did they die or what did they have? You got to analyze each and every death. Is there a law that you got to do that?
That's not true. They do not have to analyze each and every death. They have to analyze deaths that occur when there's no reason. For example, if somebody's been sick for a long time and they die, you don't have to have an autopsy. But if you have somebody who has been healthy and they suddenly die, then there's going to be an autopsy. Find out
Who
why.
pays for that?
Usually that is done by the DC, for example. They have the pathology department. And so for every death that is unexplained, they do that. I'm not sure how the costs are allocated, but that is done irrespective of your ability to pay.
I know when my mom died, Carol, she was up in age, had heart trouble. She died at home, but there was no autopsy. They never mentioned autopsy. But contrary to that, when my daughter passed, she was young, no problems that they knew of, but they did perform an autopsy. But they paid for it. I didn't.
Right, and that's exactly the way it goes. Is if you die from natural causes, that's what they call natural causes, then you wouldn't need an autopsy. But if they're not natural causes, then they would do it to make sure that you were not murdered.
That's what they said about my mom, natural causes.
Yeah.
She was 97.
Yeah, that's pretty true. Yeah.
But you can die from natural causes being young.
Yeah.
Then they need to identify, and that's why they do that's why they do autopsies on younger people who have no illnesses.
That's exactly right.
This is an article on salt substitutes, which are usually potassium containing medications. And this points out that salt substitutes really help people maintain the proper blood pressure. And maintaining the proper blood pressure prevents cardiovascular issues, strokes, and heart attacks. And this is all related to the salt, which we've talked about, salt and sugar as being causes of mortality. And so the salt substitutes, often potassium, result in having a normalized blood pressure, which of course is important to avoid arteriosclerosis and strokes. And so for a while, people took salt substitutes, but weren't as sure whether it was helping or not. But this article points out that you have a reduced risk for mortality when you use salt substitutes.
Wasn't there a long time ago an article that said salt substitutes were bad for you and not to use them?
I'm not familiar with that article, but there's always been discussion about the role of salt substitutes. But most of the evidence indicates that salt substitutes are of great merit.
Yeah, that conversation may have been about sugar substitutes.
Yeah, sugar substitutes probably. Yeah.
No, I read somewhere about like Miss Dash and all of that, and they said don't use it.
Well, the general feeling is that salt substitutes are of merit and that they're very helpful. Any other questions about that? Because it's important, because I think the concept of salt substitutes in contradistinction to the sugar substitutes, which is another issue. Now this article, because I thought it was a good one, because there's been a lot of talk about whether or not doctors should accept gifts from patients. And in this article, they talk about how a doctor was on a scuba diving trip and somebody had seizures, and he helped, and they gave him a present. And the present was very nominal, cupcakes and flowers, which are pretty nominal. But the issue that comes up is if they come up with gifts that are just like an airplane or a car or a boat or something like that. And I think this becomes a different issue because one of the things that I learned on my trip to Africa that sometimes accepting or not accepting gifts has important cultural issues, and not accepting a gift may be an insult. And so, so if it's a minimal gift, then it's probably not a problem. But when it gets to the point that it's more than something that's $50 to $100, then that's called it's not a modest gift, and that involves a conflict. And so they're suggesting when something like that happens that you should decline it with a good explanation. And see, this idea characterizes value of greater than $25 or $100. And I would think that the gifts greater than that probably may get you to talk to the patient and tell them why you cannot accept it if possible.
Dr. Callender, have you received many gifts?
Yeah, like sweet potato pies, apple pies. You know, very inconsequential gifts like that. Yeah. Nothing huge. Yeah. So
Then I feel terrible because I don't know, something I was, maybe I've been programmed the wrong way. I just thought that doctors were rich, and I didn't realize that they would accept gifts. I don't know, I've never given a physician a gift.
thank you is a great gift.
Okay, thank you. Yeah, and I'm indubitably grateful, and I say thank you and everything, but
That's
a
good. That's a
monetary
great
gift.
gift.
And I was just wondering how many on this panel have actually given a doctor a gift.
I've never done it, but I know there's labor department rules in regards to like union leaders, which the same thing applies as far as I couldn't accept a gift of over $25 because now you can be accused of showing preferential treatment towards a contractor or whatever. So they if you received anything over $25, you had to report it.
I was getting ready to say that same thing.
Yeah.
But I'm talking about actually giving your doctor a gift. Anybody on this panel has actually given a doctor a gift?
I've never
No,
given a doctor a single gift.
Other than thank you. Thank you is a gift.
thank you.
So-
I know, Dr. Callender. I
Yeah.
want to hear for the rest of them. I know we say thank you, and some doctors are more grateful than to others.
So
But-
I was gonna say, so my kids' mom, when in labor and delivery, when she was really impressed with the nurse who helped us deliver the second child, and I found out why too. It's because of like the oxytocin hormone, the bonding hormone, especially when women give birth, especially natural birth. Like there's a bonding that happens not only to the child, but especially to everybody who's in the room that's surrounding and loving. So she just felt really, I guess, what's the word for it? She felt really inclined. She felt
really obliged to kind of give the nurse who was really nice to us something. I forgot what, I don't know if it was like a teddy bear, a card, or something like that, but that was the closest that like we've ever given to somebody who's like been good to us in healthcare.
And that's the kind of gift that, is reasonable. Card or a teddy bear, those little things like that are easily acceptable.
Yeah.
Now, what I have done with my brother and with my mother is I have given the ward that my mother was on, like a box of candy or a box
Yeah.
of cookies to thank them
Right,
for their care for my mother and my brother, but
And
not
those are
nothing to a doctor.
those are the kind of gifts that are acceptable. They're minimal. Box of candy, those kind of things.
It makes you consider something you may not have thought about. We gave a like a snow globe, to a therapist, and he was reluctant to take it, and this article, makes it understandable why he was hesitant to receive a gift from us. Eventually, we twisted his arm and forced him to take it. So, and he did receive it.
Okay, well, it's good, interesting. Yeah.
Well, I was
Okay.
just wondering, are there some cultures that give gifts more than other cultures? And are we taught that? That's still amazing to me. I know as a teacher, I would get perfume. I still got a dresser full of perfume that I need to throw away. They give us perfume and stuff like that. And you say nice, and have gotten cakes and pies. Yeah, it's nice. So, but I never thought about a doctor. I know one time John was indubitably grateful to a nurse for, during her help and everything, and he volunteered to take care of her newborn, because she was a single parent, a newborn or a baby for overnight when she had a 12-hour shift. So
That's a nice kind of present.
that was a nice experience.
A nice present.
Yeah.
Okay.
Again, I think it depends on the financial status of the giver, the person giving the gift. For instance, in Africa or in my country, where most of the people are poor, they hardly give any gifts of any amount or any value. The only thing they say is thank you. It depends on the status, financial status of the giver. Most of them are poor. They can't afford, even 1 square meal a day. Where will they find the money to buy an expensive gift or even a teddy bear or a card? So
Well,
it depends.
Thank you doesn't cost anything. So
Yeah.
I'm reading an article from National Library of Medicine where it says doctors often accept gifts from drug companies.
yeah, that's true, but that doesn't mean that they should. Right. And that's why this article was about it, because that has now become illegal to accept gifts above certain. But there was a time when that was just automatic. That the law has changed on that now.
By the way, I got an idea why those doctors were getting gifts from the drugs company. They wanted them to prescribe their drugs.
Of course,
Okay.
right.
Yeah.
Right.
Of course. So the other side of the fence, though.
That's why it's illegal.
Yeah, I was getting ready to talk about the other side of the fence when it's illegal for a doctor to get a gift because he let somebody have a whole lot of Oxycontin or something.
Well, that's illegal. So
Yeah.
that's a different.
Yeah.
That's very illegal.
Yeah, because it goes back to Michael Jackson and Prince. The question was, how did they get a hold of that stuff?
Okay.
That propofol.
Okay.
Ju-
Now,
drug companies do leave samples and stuff with doctors, though. That's not illegal, is it?
They still do that, yes.
Yeah. Okay.
Now, this is an article about talking about anal sex. And one of the things that has changed over the decades is talking about sexual intercourse, whether you do it vaginal or whether you do it oral or whether you do it anal. And this article talks about the fact that it is part of the sexual history to find out whether your patient is involved in anal or vaginal or oral sex. And this is from the UK. And I know when I've talked with my medical students, a lot of them are not recognizing that in this day and age, talking about whether you're vaginal or anal or oral sex is important. And that's just part of the normal history and physical. Although nowadays with x-rays, a lot of people aren't doing thorough history and physical examination. But this is something that just as, for example, some people, I think John Buchanan mentioned that many doctors no longer do an anorectal examination. And that's a problem because even when they do the colonoscopy, sometimes they don't thoroughly examine the anal rectal area. And I think that's a mistake and a change that we need to do away with. But it is important, therefore, that the type of sex you engage in becomes part of the sexual history of the patient you address. And there have been many discussions about that.
Yeah, among young people, and I think the article says 16 to 24, anal sex, the incidence of that is about doubled recently. And the other thing that's getting popular among the young is oral anal sex, eating someone's anus. And of course, there's a lot of diseases that are associated with that. This article talks about anal trauma and incontinence as being a common aftermath of anal sex, which could be more problematic for women because they have a more fragile pelvic floor. And of course, like incontinence, that's one of the extreme consequences of anal sex. They say that's the reason why Kobe Bryant was involved with the rape of the woman in Denver, and they say that's even though she had been with two other guys the same day, that's possibly why she pressed charges the next day because she found that she was incontinent after being with Kobe Bryant.
For those who don't understand, incontinent means that they're unable to control the passage of urine or feces. Right.
Well,
Next.
which doctor is supposed to control or question you about your sexual life?
Your family doctor.
Your GP?
Yes. Yes.
Okay, again, I'll ask the question. And anybody's GP ever question about their sexual life? Because none of mine have ever asked me. No.
Most of the older doctors are not used to doing that, but the newer generation of doctors needs to do it. And I teach all my medical students that they need to do that because the sexual history becomes very important. But you're right, the older doctors, that was not something that was common those days, and talking about anal sex was not part of our education, but that's different now. As Darryl mentioned, the incidence of anal sex has increased markedly since then, and often it's because the male wants to do it, and they then introduce it to the female and so forth. And
Yeah,
so,
it's a great conversation that mothers can have with their teenage children, or I'm not even sure, maybe grandmothers could have with their teenagers, because since it is becoming popular, they're not aware of the risk. And,
right.
the young girls need to be told, avoid this because there are some very potent physical risks associated with anal sex.
I had a question, Dr. Callender, about E. coli. That's one of the bacteria in feces, right?
Yes.
Can you get sick off of your own E. coli?
Yes, you can if you're immunosuppressed, but usually not. If you're not taking medications to suppress your immune system, your own E. coli generally not a problem because they're present in the GI tract all the time. So under normal circumstances, the answer would be no.
But definitely somebody else's E. coli you can get really sick off of, right?
Yeah. E.
Don,
coli,
what you got to
E. coli is a one of the commonest sources of infection. Yeah.
We've got a younger generation that's being raised on porn. Even if you put all kind of blocks on their cell phones and their tablets, they're looking at porn on their friends' computers, tablets, and iPhones. And a lot of the porn that they're watching is showing vaginal and anal sex and oral sex all in the same sessions, and along with orgies. There could be 3 ways, 4 ways with every type of sex. And so, they're watching it and it's like monkey see, monkey do. And so now you get E. coli, incontinence, STDs. You get all of that. You get the
Monkeypox.
invitations through the internet, and they don't know the risk.
Monkeypox, you get it?
Through that.
Okay. Any other comment? If not, this is something that we have talked about in the past, but not recently. And that is that environment plays a much larger role than genetics in psychotic experiences in adolescence. We talk about genetics often, but it's really the trauma that you deal with in your day-to-day life, especially socioeconomically poorer people. You see a friend or other person being murdered. You see somebody being traumatized, or you get traumatized. These are the environmental experiences that are more likely to be associated with psychotic experiences rather than the genetic issue. And this is true in general anyway, because the environment does affect the gene. And so your environment plays a major role in genetic profiles as well. So when we talk about psychotic experiences, a lot of it has to do with what happens to children, to young people while they're growing up. And sometimes we forget how devastating it is for somebody to have one of their peers be killed or to be traumatized, beaten up, or assaulted. And so this is where a lot of the psychotic behavior begins.
This is interesting to me, because in short, this speaks to the nature versus nurture argument. So I guess this is saying that it's more nurture than it is nature. And even though someone may have their genes may not be, they may not come from the best stock. It seems like, the nurture could help to the nurture can either help with that or propel that even more. So it's interesting. It's just all interesting.
Yeah, I think that sometimes we underestimate the importance of what happens in your environment. And we sometimes tend to put a lot of it on genes, when in point of fact, the environment, the social determinants of health play a major role in and who you are and how you behave, mentally, physically, and otherwise.
So yeah, this particularly speaks for kids who are adopted, or kids who are taken in by their parents, taken away from homes that are less than. It seems like it can give them a better start according to this argument. So that's affirming.
Any other comment? Because it it relates to what has been identified, that even younger adults, that a lot of what they become and a lot of their medical issues relate to the environment they were surrounded when they were much younger. And I'm sure you teachers, and many of you out there are teachers, are more familiar with that than I am.
Yeah, my son is a fourth grade teacher, and the things that his fourth grade students do as far as like stabbing each other, and you find out that they come from families that have witnessed all this in their not day-to-day life, but they witnessed it. And and so they're behind the 8 ball already, just by where they're growing up at and what they're seeing.
I was looking at a data item that indicated that people of color are associated with homicide almost 4 times as often as those of other vintages. And so if you're surrounded by it and you see it, that will affect you for the rest of your life. And these bullying things that kids experience in school, as you're mentioning, affect people sometimes for the rest of their lives. And if they don't get psychotherapy, it may plague them for the rest of their lives.
One thing that I'm real quick noticing about this article, though, I saw a little bit above, they said that the studies were done overseas in the UK and in Sweden. Didn't see anything there. I mean, I'm just skimming it too, but I didn't see anything for the United States. So
that's exactly one of the problems of a lot of the literature, is that we don't see a whole lot of it from the United States, and we probably have more of it than they have.
I really believe
much
that,
more
yes.
than they have.
Yeah.
And that brings up to mind that you have to be very careful about all the articles you read, because where they come from becomes important, and whether it can be adapted to what we experience depends upon where the study is, who does the study, and whether or not they have people of color involved in the study. Often they do not, and that's why reading it, you have to look at it from that kind of perspective. And proper analysis requires you to give merit or dismerit relative to whether or not it's the population we have or not.
Amen.
Oh, this is from Carol, because she recognizes that you should be doing your penal exercises, stand up and stretch every 30 minutes. And so she put that in there. Thank you, Carol. I mean, if you didn't put it in there, whoever put it in there, thank you. But that's more of a Carol Tatum touch. Now, this is an article that just talks about common decency. And you have people who have all kinds of implants, and when the device maker goes bankrupt or something, then what are they supposed to do? And this is something that kind of represents man's inhumanity to man. So you have something like this that happens, and these people are just left in the lurch and with nothing to do, and nobody cares about it. And this is an article that wants us to be more sensitive, because we have a lot of people who have implants these days, because they have arrhythmias, they have heartbeats that are too slow, they have fibrillation or other things, or even ventricular fibrillation. So they have these kind of implants. And then if you have a company that goes bankrupt and you don't have a way of addressing it, then what are you to do? And this was just to have us to think about, because nowadays we're talking about many people are alive because they have special devices. And so some people can see because of special devices. Some people live because of special devices. So this is an article that just requires the FDA and other groups to be sensitive to situations like this when proprietary medical devices are no longer available. I'm sure nobody in this group has any of those devices, but it's food for thought.
Dr. Callender, I was wondering about these commercials I see where they have the patch on their arm or on their tummy that monitors. They can put their phone up and monitor their blood sugar. Are those considered implants as well?
Yes, but those are so common that it's likely not to be considered here. But yes, those are implants. And the diabetes ones are the commonest. And they're life-changing.
I was just wondering how does that affect the person wearing them? I mean, can you exercise, go swimming or whatever?
Yes,
On?
yeah, yes. Generally, most of them are done in a way that they can protect themselves, and they can swim, those kind of things. Now, this is an article on the way things are changing now that we're becoming more COVID sensitive. Since most of us now are fully immunized, it is thought that it's safer to not need social distancing, quarantine, and testing as much as we used to in the past. And so this, the new recommendations that they've made, and they include the fact that you don't even have to quarantine people who are now positive. They should mask, but they aren't also required to quarantine. So we've become highly liberal in dealing with COVID positivity, as well as also nowadays, if you have a reinfection after 5 days, they aren't even requiring you to be retested, although it makes sense. And it seems that they're giving new value to your home tests, since they're now available, widely available. And the reason is because the need for hospitalization and death from COVID-19 is becoming less likely because most people are fully immunized. Now, of course, those who are immunosuppressed, it's not quite clear what that means to them. And this article further talks about the fact that the need for quarantine is no longer applicable.
You know, Dr. Callender, the PG County schools just last week or earlier this week require now masking for the students in the public schools. Carol, you know about that?
So I work in PG County Schools, and yes, I know about that as well.
Yeah, okay.
So how did the students respond to that? Are they in, or are they wearing the mask on their chin?
So no, the students go back on the 29th. But yeah, at the end of last year, yeah, we got all kinds of rule breakers and folks who we have to keep reminding them to put their masks on and stuff. So overall, there's a good mix. There are certain students who are they are mask wearers, and then there are those who kind of just thumb their nose at the rules. So it is there are those who are particularly protective and those who are kind of careless with it. So it's a good mix from what I've seen.
Also, the parents are like that too.
So true.
It's actually interesting. I was talking to another parent, and they were saying that there was a faction in Virginia whose parents were advocating for no masks, and they were kind of getting riled up about it. They did not want their children in, so they would do the whole protesting thing and showing up to schools trying to advocate for their children not to wear masks. I mean, it's just a faction. It wasn't everybody, but it's still interesting to see that dynamic, that they were getting really riled up about this issue. So it's become quite the scene.
Must be interesting to see, and a lot of it has to do with what is going on in your location in terms of the need for hospitalization and or not. And in DC, it seems as though things are relatively controlled. Now, this is an article that fits right into the profile of what Darryl was talking about. In terms of it may be time to ban kids from social media. And they talk about this because there's so much going on in social media. And are the parents aware of what is going on in social media? And if they are they happy with it? And what's even more, this study analyzed whether the kids are happy with it. And here again, this is the UK you're talking about, that it seemed that the self-reported social media looked at it and they found that the children were not really that happy with the social media. And so the question is, should we continue to let kids be exposed to social media as we have been doing? What are your thoughts about that topic?
I don't
I
have
don't think,
kids around me, but I'm not for hardly any of the social media. I think it's all just overblown, just crazy.
I think social media definitely has a place, but it's almost impossible to regulate.
I'm with you. I think the same thing. I don't think, you're going to stop the social media fad because, it's just, everybody uses for everything. I mean, anything you want to know, you go to the social media, you go to YouTube, you go everywhere, and you can get answers to different things. And
But some of those are inaccurate answers.
well, I mean, you have to use discernment and research to be sure you're getting the right information. But I don't think you're going to stop this phenomena here.
I don't think either, but I think we should. I think it's a good idea to ban it for kids at certain ages. But it's not going to happen. But I think that the parents have a responsibility, and and I think the more parents are sensitive to what the kids are watching, the more important it is. So if you're monitoring it, then I think it's probably sensible. But if you're not monitoring it, I think it's dangerous.
I've seen some children, 11 and 12-year-olds,
Yeah,
that are, they demand their laptops or their iPads, their tablets, their phones, and they really, they're so connected over those devices that it a lot of times it seems to be unhealthy. Just the fact that they can't live without them nowadays, it looks like.
Well, how do you ban it from youth or children?
So I can speak up here. So I have a daughter who is 11. I have a son who's 14. So they're right in the thick of it, according to this article. Shorter answer is it's a lot of work for parents. We have to stay 2 steps ahead of them. And so that's a lot of that, especially if you're not tech savvy, that's going to be a learning curve, and you have to understand, what it is that they're on. And they'll still find loopholes, and they'll still find ways and avenues to get around what because there are such thing as parental controls that you can set up on devices and stuff, but you have to be savvy enough to understand how to enact and enable those controls. So it's a lot of work, but being a parent and doing a parent thing the right way, is always going to take a lot of work. And lastly, there's a difference between social media and just the internet in general, because a lot of times we mix up those 2 terms. Social media is specific apps like TikTok, like Facebook, like Twitter are the ones that are most popular with teens. But looking stuff up, that's just the internet by itself. And it's all. I agree with the comments that were said before. We're not going to escape this. If we're going to raise children the right way, it's like we have to stay in front of it. I always ask my kids, what is it that you're watching? What is it you're looking at? Show me the screen. Like I have to do spot checks every now and then. And yes, there's a lot of monitoring, but I signed up to be a parent, so this is the life that we're living in currently, and so this is what I have to deal with.
Amen.
Yeah, the comment, that's a very, very important discussion that you just had. Any other comments about it? Just very enlightening.
I applaud Mark, and I'm glad my kids have grown and gone.
Well, it's at these times, difficult times.
It is.
Yeah, and the availability of getting the true facts on the internet and addressing social media and recognizing the difference is an important concept.
Yeah. But there again, I think a lot of it starts at home, like Mark said. You have to be vigilant. Yeah.
It's tougher being a parent these days. Yeah.
Question.
And it's even tougher to be a grandparent because I'm clueless. They come over with this and they show me their phone. I say, that's nice, baby. I don't, getting on TikTok and all of that. And then if they try to educate the grandparents, the kids will be grown by then.
Well, there's a lot of education that the grandkids can do to the grandparents. In one of our research projects, that's one of the things we did. We used the grandkids to educate the grandparents, so they learned how to use the social media, because I think it's an important cog to get together the grandparents and the children, so that we actually expected the grandkids to educate the grandparents and help them to be medically responsible. That was part of the research project, and it worked well, as the kids did educate their grandparents and teach them how to use the internet and other things. Not TikTok and those things, but the internet.
Yeah, well, there was one, my granddaughter, I think it was Mark's daughter, they had a threat at their school, and Mark can explain it better than I can, but somehow the message jumped from their phone to everybody's phone in the building about a bomb threat or something like that. and you had to have an iPhone for this message to be delivered to everybody, and the school was shut down and everything. And I just thought, wow, that's amazing. And every kid almost got it on their cell phone.
Right.
This message
right.
about it.
That's right. That's the way it is today. So, yeah.
Also, kids have a whole other language that they use, the coded language, so they can communicate without their parents even knowing what they're talking about.
That's true. As a grandparent, and my grandson lives with me, so whenever I need some advice about something, I'll call him in because I know some of the stuff I'm not tech savvy to do. So that learning from grandchildren is truly right.
Yeah. This next article talks about some of the ways that they discriminate against us. This is interesting because they had denied some of the Black NFL retirees because they just described race norming in the dementia testing, which was unfair. And as a consequence, they sued and actually won. But it's amazing the many ways in which they discriminate against people of color, whether they're Latino or African American or whatever. And this is an instance in which they took advantage of their so-called racial norming. And of course, being someone who doesn't believe in using race for anything. This is an example of where they used that so-called racial norming to deny African-American players from getting the funds that they needed for retirement. This is a kind of a awful situation to be associated with, but that's what actually happened. And since most of I guess the majority of players in the NFL are people of athletes of color, so it's a problem. So it's good that they recognize this and did away with it. Now, what is deceptive is they talk about $1 billion in approved claims, but if you actually know anything about the NFL and the NBA, $1 billion is chump change to them. They operate in the multi-billion-dollar level. Okay, it's 10:30 now. I guess is there any more? This is the last article?
Yes, that's it. This is it.
Okay. All right. So we had an interesting array of articles and I think we had a great discussion, and it's nice to see most people back. I see Janice isn't back yet, so I hope she's well. And I don't see Pearline Freeman there either. But anyway, glad to all of those of you who could attend. And if there are any other questions that you want to have before we close out? By the way, on September the 8th, Dr. Chinloy, the ophthalmologist from Howard, is going to give us a talk about the senior eye problems. And those of you who go to your ophthalmologist every 2 years, and those who don't can hear something about the eye problems that seniors have. That's people over 50 for some and over 60 for others. All right. Okay, with that, if there's no other questions, thank you for participating, and we look forward to having a good weekend and see you next week.
Thanks, all.
Great.